Eastern medicine, Andrea Rapkin, she's at UCLA. She does a lot of research in this area of vaginal pain, sexual pain, and is an excellent resource. She's also doing a lot of research that women can be a part of, and some of this stuff might fall under the research fund, so it's good for them to be able to check out. She does have a long waiting list, but it's well worth it. She's a rock star in these issues. And then Dr.
What is her expertise, did you say? She's a
gynecologist. They both are. Dr. Katie Moyer is actually in our building. She works at the women's clinic. Highly knowledgeable about this as well. Very, very wonderful, amazing bedside manner too. So again, it's really important to get a medical doctor involved, because you could work at it from a psychological standpoint all you want, but if there is some sort of medical condition playing a part in this and it's not being addressed, then the psychological efforts will be a lot more challenging and might not even work. So get a knowledgeable doctor on board. For the pelvic pain, this is sort of what they do, that Bergeron has found, that they get a gynecological history of what might have gone on in the past. They do a Q-tip test to find out where the pain is. They do a physical exam just to make sure that the vaginal area is healthy. And then they do cultures to make sure that they can rule out infections or diseases. They'll also find out about eating habits, diets, those things. Maybe there's some sort of allergy like gluten intolerance, and that might be, you might just need to be able to address the gluten intolerance, and then the vaginal area will sort of repair itself.
I mean, they could have get vaginal pain from a gluten intolerance?
Sometimes. Mm-hmm.
Do you also find that the pill, I've had a few patients go off the pill and then their pain all of a sudden vanishes?
Yeah, so what they're finding is a lot of women's vaginas are basically going into menopause, even at a young age. So the vaginal lining is wearing down, so it's thinning out, and then the lubrication has decreased because of the lack of hormones, and then the nerves have become a lot more sensitive in a negative way or a painful way rather than a pleasurable way. And so stopping the birth control has, like you said, it gets their hormone levels back to normal of where their vaginal ways are supposed to be, and sometimes it's as simple as that too. So yeah, really good point. So that's kind of addressing the point of, yeah.
Well, especially because that is a problem with older women. As we get older,
Yes.
our hormone levels change, obviously, but a lot of women are very hormone averse.
Mm-hmm.
And I'm just wondering about your thoughts and experience with dealing with older women who don't want to use hormones, but are as a result, become less sexual.
Mm-hmm. So there are, and with the Eastern medicine part of it, sort of helps address that, but there are other ways to work on the psychological place to help support women and get their arousal and desire levels back to a level where they were happier with. And then there are also a lot more natural ways to do it. And there's been some talk about stem cell serum that has been really helpful for women who are going through menopause and have that experience as well. So that's another option too. So in addressing the tissue damage to work on pelvic pain or addressing the sensitivity that women might experience, that's what's helpful of getting the doctor on board. And then any other gynecological or medical conditions, as I mentioned, would be helpful for the doctor to be on board to be able to tell you, okay, we ruled out everything that could possibly or potentially be involved here. And then that will give you more information. Surgery, a lot of women come to me and say, well, I heard that there's a surgery and it helps. And yes, it does help, but it's almost like a Band-Aid for these issues, because a lot of times women who have experienced this problem and are wanting to resort to surgery have been having it go on for a really long time, which means that the relationship's been affected, their own arousal and desire levels have been affected. So I don't recommend it. I only recommend it as sort of a last result, or last effort when nothing else has worked.